If you or someone you love has cancer, this might be the most important video you will ever see. The history of Coley's toxins is well documented and hard to dispute. Dr. William Coley is now considered the father of modern immunotherapy. Before I continue, you may be wondering, what is immunotherapy? It is a type of cancer treatment designed to boost the body's natural defenses to fight the cancer. It uses materials either made by the body or in a laboratory to improve, target, or restore immune system function. Immunotherapy is considered by many to be the most promising field in finding a cure for cancer. In fact, 60 Minutes recently revealed a Duke University study that showed that injecting a modified polio virus into brain tumors was producing amazing results. The recent uses of the polio and measles vaccines for glioblastoma and multiple myeloma patients is a modern-day example of immunotherapy, but the concept is nothing new. In 1891, a surgeon at Memorial Hospital named William Coley lost his first patient to cancer. Her name was Bessie Dashiell. He had amputated her arm and expected that would stop the cancer. To his surprise, the cancer came back with a vengeance, and Bessie died in a very painful death. This death devastated Coley, as he had followed strict protocol based on the information of the day. He went looking for answers and went through the files at Memorial Hospital in search of anyone who had survived a sarcoma. He came across one patient who had survived, and it turned out that patient had contracted an erysipelas infection after surgery. Erysipelas is a type of strep infection. Coley, being the pioneer that he was, went on a mission to find this patient in Manhattan. He wanted to see if the patient was still alive. Sure enough, 7 years after his release from the hospital, he was still alive and cancer-free. With this finding, Coley decided that if an accidental infection could lead to a regression of cancer, then an intentional infection could too. He decided to inject his next patient with the infection, and that patient went into remission. This patient was followed up with for 27 years when he finally died of a heart attack. He was cancer-free at the time of his death. He then went on to infect his next 10 patients, and instead of being healed, many of his patients died from the actual infection. The ones that survived the live bacteria went into remission. Understanding the danger, Coley used what is rarely used in scientific medicine today, a good dose of common sense. Coley injected his patients with a mixed form of dead bacteria, hoping that the immune system would still respond, but taking the danger away from the patient. His first patient injected with the new concoction of dead bacteria went into complete remission. This was the beginning of the long journey of Dr. William Coley and his toxins. Like any new treatment, it faced intense scrutiny from the medical establishment. As early as 1894, the AMA issued a severe criticism of the use of his toxins. There is no longer much question of the entire failure of the toxin injections as a cure for sarcomata and malignant growths. During the last 6 months, the alleged remedy has been faithfully tried by many surgeons, but so far, not a single well-authenticated case of recovery has been reported. Coley also ran into criticism from James Ewing, the most respected cancer pathologist of his time. Dr. Ewing was also a director of Memorial Hospital, which made him Coley's boss. Ewing himself had become a fanatical supporter of radiation therapy for the treatment of all bone tumors and repudiated any other theories for the treatment of cancer. By 1920, Coley's work ran into serious resistance from the Bonesarcoma Registry. This registry, established by E.A. Codman, who had invited Ewing and Joseph Bloodgood from Johns Hopkins to join him, was the first cancer registry of any kind. Its role was to standardize the diagnosis and treatment of all forms of bone cancer by collecting cases from all over the country. The cases would be evaluated by Codman, Ewing, Bloodgood, and other prominent bone specialists. Coley had a great deal of difficulty having some of his cases accepted by the registry, despite being the leading bone tumor surgeon in the country. Thus, his work gradually fell out of favor. By 1952, the Parke-Davis Company no longer produced Coley's toxin, and in 1962, the Food and Drug Administration refused to acknowledge Coley's toxin as a proven drug. Thus, it became illegal to use Coley's toxins for the treatment of cancer in the United States. Luckily, after the death of Dr. Coley in 1936, his daughter, Helen Coley Knotts, started meticulously researching all of the patients' files that her dad treated with his toxins. In 1953, Knotts founded the Cancer Research Institute and published 18 monographs of her father's work. The 896 patients treated by her father with Coley's toxins had a better survival rate for many cancers than we have today. In 2009, 2 doctors from MD Anderson Cancer Center, William K. Decker, Ph.D., and Amar Safdar, published a paper stating, "This fortuitous combination of gram-positive and gram-negative bacteria, Coley's toxins, possessed a wide array of immunostimulatory properties that allowed Dr. Coley to achieve long-term cure rates unrivaled by medical science in the 73 years since his death." Not only that, the American Cancer Society recognizes Coley's toxins as a legitimate treatment and has taken Coley's toxins off the quack list. Furthermore, the Cancer Research Institute that Dr. Coley's daughter founded is now the largest and most well-respected immunological research institute in the world. So how does Coley's treatment work? The biological toxins or infections are creating an immune response from the body. Since cancer cells were formed undetected by the immune system's knowledge, the goal is to unlock the immune system's natural fighting ability to awaken it to the fact that cancer is present. Once the heightened immune system is awakened to the fact, it will notice and kill the cancer cells. It's thought Coleys toxins create a cytokine storm. Coleys toxins can be administered via IV, intramuscularly, or directly into the tumor. Patients start with a very low dose, and the dose is slowly increased until a fever of at least 103 degrees is reached. Then, the dose is kept the same until the body doesn't react with a high fever. When the body doesn't react, the dose is increased until the fever is brought back. The stronger the immune response, the better chance the patient has. That's why it's important to continue to increase the doses of the toxins when the immune system gets used to the dose. Why is the Coleys treatment so successful at Chipsa Hospital? At Chipsa Hospital, we use Coleys toxins with the following combination of immune-stimulating treatments. 1. Gerson Therapy. 2. PUVA photopheresis. 3. Dendritic Cells vaccine. And 4. Issel's autologous vaccine. Gerson therapy is one of the most popular and successful degenerative disease treatments in the world. Invented by the famed Dr. Max Gerson, Gerson therapy detoxes the body and stimulates the immune system to operate with optimal performance. Unlike traditional Gerson practitioners, Chipsa does not believe that Gerson therapy alone is enough in most cases. Photopheresis is an immune-building technique where a small amount of a patient's blood is taken and lymphocytes, a type of white blood cell, are treated with UV light and then returned to the body. PUVA includes the additional step of preparing the blood to be more reactive to the UV light. Once returned to the body, these treated T cells trigger an immune response from the cytotoxic T cells, which in turn attack cancer cells. This technique has been approved by the FDA to treat T-cell lymphoma, and improved understanding of its mechanisms of action has allowed its application to other cancers. Importantly, PUVA photopheresis can be used to amplify and improve the immune response to the Coley fluid when the two treatments are integrated. For the dendritic cell vaccine, imagine the dendritic cells are the immune system's spotters. They identify disease cells for attack. Because cancer patient dendritic cell populations are both sparse and suppressed, early attempts to vaccinate cancer patients with killed cells from their own tumors mostly failed to provoke anti-tumor lymphocyte activity. However, when DCs are removed from a patient's blood and then cultured, they quickly multiply into an effective fighting force. By extracting a small sample of tumor from the patient, malignant tissue can be killed, broken down, and fed to culturing DCs that learn to identify the cancer. When returned to the patient, these massive numbers of trained DCs are skilled at locating the cancer cells and will trigger anti-tumor immunities. When used in conjunction with Coley fluid and PUVA photopheresis, tumor-loaded DCs increase the likelihood that tumors will be completely cleared. The last treatment mentioned was created by Dr. Joseph Issel's, who spent his last years as an advisor at Chipsa Hospital. The Issel's vaccine stimulates the formation and activation of T helper cells. These cells interact with cytotoxic T cells, boosting their ability to fight infection and disease. The vaccine is cultured from the patient's own blood that represents his or her own unique internal bodily environment. The preparation follows procedures that favor the development of antigenic peptides and other immunogenic compounds aiming to enhance the body's immune functions. At times, many patients will experience pain at the site of their tumor between 6 to 48 hours of injection. Hyperbaric oxygen therapy. Chipsa has been using hyperbaric oxygen therapy for over 25 years. It is finally being accepted in the United States for treating many ailments. The hyperbaric chamber promotes extremely fast healing and greatly increases oxygen to the blood cells, thus increasing blood flow and stimulating the immune system. This treatment is especially great for patients that come in sick and weak, as their recovery time and pain is drastically reduced in just a few treatments. The combination of Chipsa's integrative immune-stimulating protocols gives the patient the best chance for healing. For more information on our integrative treatments, please contact us at 855-624-4772.